child suicides were at the highest I've ever seen in my career during that time.
At 6 years old, she was already trying to figure out how to help people. She went on to become a licensed psychologist, ran a company that grew from 50 to 600 staff, and now she's the CEO of Roya Health, on a mission to fix one of the most broken systems in America, children's behavioral health.
I would say my journey as a psychologist started when I was 6. First, I had a staff of 50 to begin with. When I left that organization, we had close to 600. He told me at the time I was a unicorn. It can be quite lonely being a CEO or an entrepreneur.
Do you believe in work-life balance? Is it a real thing or is it a myth?
I think it can be a myth. We're the hardest ones to take our own advice. Not everything that's happened to you is because of you, good or bad.
She's here to talk mental health, entrepreneurship, burnout, and what it actually takes to lead in healthcare. This is Dr. Shar Najafi-Piper, and this is Doctors Unscripted.
Welcome to Doctors Unscripted. Today I'm so excited to have Dr. Shar Najafi-Piper here, who is the CEO of Roya Health. Today we're going to be talking a little bit about everything from mental health to entrepreneurship and what that's like. So Shar, thank you so much for coming today. Very excited to have you here. Would love to start off first on a little bit about your background. So you have a PhD in psychology.
Correct.
Talk to us a little bit about that and kind of how you went from school to being a rock star CEO like you are now.
Oh, thank you. And thank you so much for having me on. I would say my journey as a psychologist started when I was 6.
Okay.
So when I was 6 years old, I was really trying to figure out how to solve problems within my parents who were disagreeing over what to serve me for dinner. And I quickly realized, wow, I actually think I'm pretty good at mediating, trying to solve problems. And when I became a teenager, I realized I'm really good at solving problems in a way that helps people feel comfortable. I think that my relationship building skills is really just innately within me. So then that led my journey to becoming a licensed psychologist. And during my time as a licensed psychologist, I quickly realized that I have a little bit of business acumen as I'm a clinician, just a little bit. Wherein I started realizing that what a P&L means. I started working towards, wow, these are the amount of appointments I need to have to be able to keep the lights on. And so I had a phenomenal mentor and CEO who essentially gave me everything I needed to know to run a business on the outpatient side. So I went from being an all-in clinician where I served kids mostly, kids with complex care. And then I started looking at ways in which I could multiply my clinical skills by way of infusing some business aspects into the work. And he told me at the time I was a unicorn because typically clinicians don't have a lot of business acumen and vice versa. So he took what naturally was already inside of me and he helped support me and mentor me. And so I give him a lot of credit for
obviously,
where I am.
I was going to say, so obviously mentorship has been huge in your career growth. What do you feel like is needed to be a good mentor? Or if you're looking for a mentor, what should you look for in a good mentor?
Yeah, that's a great question. You know, for me, I love and a lot of humility in mentors. I think that mentors who are sort of at capacity related to the knowledge that they already know have not been a great fit for me. Okay. And so when I'm mentoring young women, for example, when I'm really trying to advocate for them to have good self-esteem, I come at it through the lens of I don't know everything about everything. I know my subject matter expertise is in this realm, and I want to learn just as much from you as you learn from me, and that works really well, I think, when looking for a mentor. The other piece is someone who doesn't take themselves too seriously. I think it's really important when you're looking for a mentor to have that organic relationship, and it's hard to do that when you don't have someone who just has a little bit of fun with it, is humorous, and doesn't sweat the small stuff.
Oh, I love that. I think that the mentors that I've had, if I look back, you have that relationship where they can tell the truth without offending you. And I think that anybody that's going to be a mentor, if they can't talk to you about the truth of where you're at and where you need to go, they're not going to be a good mentor for you, just because you have to have that honest frankness to be able to do that. But at the same time, if you're too serious, right, then it's not even fun.
Yeah.
So, you know, graduating as a licensed clinical psychologist, obviously you started your career and you've done some pretty cool things. So can you talk to us a little bit about what led you to starting Roya?
Yeah, thank you for that. You know, as a clinician, I always have a heart for the member first. But I realized when I was 2-3 years into being a licensed psychologist and practicing as a practitioner, I realized that what I have inside me is really looking at it through a macro lens, and it was really hard to make big systemic changes one patient after another. So that's why I really partnered with my CEO at the time, and I said, teach me everything you know about the business aspects of what we do, so that the impacts I'm having on 1 to 8 patients a day could then be expanded into thousands, hundreds of thousands of members throughout. And so that was really where my heart was, really making sure that the excellent care that I was providing, that other clinicians were providing, was done in an efficient way so that we could multiply the efforts and really impact the lives of those we serve. I would say that then led me to running multiple clinics, both in the greater Phoenix area. Then I just quickly kind of went up the career ladder. That CEO, I was with him for almost 15 years.
Wow.
And he allowed me the opportunity to not only be his right-hand person, but also the ins and outs of an outpatient clinic, unlike any other I was exposed to. So I like to share with my team that I was the front office person, I was the back office person, I've been a psychologist, I understand the clinical aspects, medical aspects, and all of the administrative functions that go into the work. That then I think lent some credibility to the work, wherein my staff, at first I had a staff of 50 to begin with. When I left that organization, we had close to 600 staff that I oversaw. And I was under the illusion after I left that company that providers don't have a lot of influence in systemic changes. I thought that I had to go to an ACO or a health plan to be able to make those systemic changes. I was wrong. I spent 2 years really working on integrating the state of Arizona between physical health and behavioral health. That was a really cool journey for me, because I joke that I felt like I was a printer salesman, where I would go to the pediatric or primary care offices and I'd say, are you interested in behavioral health integration? And the response was, no, I really am not. I don't have the space for behavioral health. And so that was really empowering for me to realize that there's really not a lot of that intersection between physical and behavioral health. Our state has done a beautiful job of layering on some federal grants and allowing the state to be able to be progressive in that area. So I learned what I could in those 2 years, and then I brought it back to the provider world. I was a CEO of one of the largest integrated healthcare meets housing, which is what I branded for the organization, in the Valley, where we really were focused on the housing aspects of the work and also the healthcare aspects.
It's a huge deal.
It was huge. At the time, we grew the revenue size. We grew our housing projects. We grew our healthcare arm. And I learned a lot about adults with serious mental illness in the state of Arizona. But my heart is with kids and families. I'm a licensed psychologist for kids. And so post-pandemic, I realized that a lot of kids were getting really housed out of the hospitals for having complex care. Kids with autism, behavioral health conditions, medically fragile conditions, unfortunately were either getting sent out of state or they were being housed out of the hospital, because there really was little to no integrated types of efforts for them. And so I partnered with a pediatric office to be able to do that with Roya Health.
So, love the introduction to Roya. So Roya really focuses on that pediatric behavioral health, correct?
Correct. Pediatric and families.
And families. Okay. So let's talk a little bit about what are some of the unmet needs for youth in the behavioral health space.
Oh, I wish I had 3 hours for you, Justin, to talk about that. I would say that the top 3 to 5 for us that we see through the schools, through the hospitals, and through the pediatricians' offices that we then go ahead and screen for are depression, anxiety, autism-related diagnoses. And then, unfortunately, when you layer on any kind of medically fragile conditions, and this could be anything from diabetes to an extremely rare cancer and everything in between, there's not a lot of systems that help support that type of integration.
Yeah.
So it is a fragmented type of work. And so we want to change that at Roya. We want to come in and layer on that whole person care for those kids.
So if you're a parent that has a child that has one of these conditions, obviously it can be very mentally straining both for the parent and for the child, especially if you don't know that there are resources out there to be able to help your child.
Yeah.
What would you say as far as messaging to those parents that are looking for resources, they don't know where to turn to? What would be your message to really helping them guide them to the right space?
Well, hopefully call Roya. I think that's one area where we can not only help navigate the system by way of letting you know maybe Roya Health is not the provider of choice, but we can help them to understand how the system looks. The other resource is honestly calling the schools. The state of Arizona is very progressive in the ways in which they've layered on mental health and behavioral health resources for the schools.
That's great.
And not a lot of families know how to access those resources through the schools.
And so talking to the school, where do you start? Like, do you go to, like, I don't even know where you'd start.
Yeah, it's a good question. I would definitely start with the school counselor.
Okay.
Most, if not all the schools, public realm, private realm, have school counselors, whether on-site or virtually, where you can access resources. And if the school counselor does not know, the principals should
Will
know.
Okay.
Yeah.
So great advice for anybody that's in that type of situation. If you have children, they have behavioral health issues or mental health issues, and you're trying to support them and help them, ensuring that the school knows about that and knows what they can do to support, as well as the resources that they can help to bring to your family, can make a massive difference in the quality of life, in the health of these families and these people. So love the advice there. So one of the reasons that I get to interface with behavioral health is also obviously in the pain space, right? You have some great experience there as well. Let's talk about when people are in pain. A lot of people don't realize that there also can be a lot of mental issues around pain, whether that's addiction, but also people that are in these types of conditions, whether that's bipolar or any other mental health condition, they oftentimes can suffer from pain as well. So can we just talk a little bit about how behavioral health and pain interact? What's been your experience there?
Well, the intersection's quite profound, related to individuals who have experienced any kind of pain. And then when you layer on behavioral health conditions, the unfortunate part is that the two can exist together, and sometimes it's very fragmented the way the system works. And so a lot of patients feel like it's either or. So I can either go to my pain provider or I can go to my behavioral health, and usually they choose their pain provider over their behavioral health providers. And so I would just ask anyone who's experiencing those kinds of symptoms by way of pain and going to a pain practice to partner with those pain practices to also receive behavioral health as well. What we see in our practice, we also have a center of excellence with a health plan related to individuals with substance use disorders, also who are in and out of the hospitals and are having a really hard time with navigating life because of the substance use diagnoses. And sometimes those individuals exist in pain practices.
Absolutely.
And so you are quite, I would say, heartfelt in the way in which you approach this care for this membership, because when you do screen for addiction or any other substance use disorder types of symptomologies, then you do refer to behavioral health. I think that's key for any and all pain practices doing the work. Having good coping skills as you're going along the path of receiving services at a pain practice is also extremely significant. You cannot maybe have those addiction types of symptomologies, but you also should be able to know how to cope during any and all of the interventions and treatment paths that you all prescribe to the member.
Absolutely. I talk about this quite a bit in the fact that when we do deal with people that are addicted or have some type of substance abuse disorder, trying to look at this, I think in the pain space, a lot of people say, oh, well, they're just drug seekers, or, they're addicted and they're just trying to get a fix. But the reality is, if somebody's in pain and they have an addiction, because they're very addicting, some of these meds, I don't think it's possible, and I could be wrong, but I don't think it's possible to get over an addiction while still suffering from chronic pain. Because it's this positive feedback loop, right? Of, I have all this pain, which drives me to want to take something for the pain, but then I also have this addiction, which then in turn goes back to the pain.
Right.
And if you can fix chronic pain and you can fix the addiction simultaneously, that's where you're going to see really good results with patients being able to get their life back, quality of life back specifically. But I don't think it's possible to fully fix somebody's addiction while they're still in massive chronic pain, because it's just going to drive them back to that. Working with this population, how have you seen that interplay in a fragmented healthcare system like we have? Have you seen that to be true, where it's very difficult to work on addiction with patients when they're still suffering with chronic pain and they're not both being treated simultaneously? Or have you seen the opposite and you've been able to work on addiction without treating the pain?
I think both can exist at the same time. I think partnering with great providers like yourself who understand that we have one aligned goal for the member, which is to keep that member healthy, is important. I wish all of the providers that we work with on the pain side had that same type of mission-oriented practice.
Yeah.
I also think that, to your point, it's the chicken and the egg, meaning, if you're dealing with chronic pain day in and day out, and you're highly depressed and you're immobile and you're not functioning, it's really hard for us in the mental health field to come in and say, okay, you're going to need to take a walk 30 minutes a day to uplift your mood and get those endorphins going. It just doesn't make sense for the member or the patient. So it's really important for us to align within the system, collaborate, coordinate care. What we've done at Roya is do a beautiful job on the coordination piece.
Yeah.
I think when you get on the phone and have a doc to doc and say, hey, I've seen Shar Najafi-Piper here for a year, her pain's not getting any better, can we align on a treatment path for this member? That goes a long way, and unfortunately we just don't see that very often in our system happening.
Well, and I'm a huge believer in multi-specialty care. That's what our whole group is built on, is bringing all these specialties together to collaborate, because as you said, it's very fragmented. However, I've seen a lot of people in Arizona trying to bring behavioral health into a pain practice, and the way that they do that frequently is hiring, a social worker or some form of, mental health specialist to bring them into their practice. Where I've seen that fail is that they don't have the resources to treat everything that's needed in the behavioral health realm, while also dealing with everything that's needed in the pain and interventional pain space. And so where I've seen it work best is actually where groups that have a lot of the pain physicians collaborate very closely with a group that's very deeply integrated in the behavioral health space, so that each can work with the patient on all of their various needs, but then they're communicating and bridging that communication gap so that they're actually helping the patient progress, but with the resources that are needed to fix both. That's how I've seen it work best. But I've also seen a lot of people try and fail. What are your thoughts on people that are trying to bring behavioral health into a pain group?
So I can speak to the experience I have with behavioral health going into a primary care pediatric office that will be relevant to a pain practice. I think most of the PCPs or pediatric offices will tell you that if and when they've tried it, in terms of bringing behavioral health services in under one umbrella, they were able to try it for about a year or two, and then unfortunately that particular operation fell short and they had to close that line of business. And I'll share operationally with you why. So a PCP or a pediatric office runs every 8, 10, 15-minute appointments. So it's a very fast-moving type of environment. Whereas on the behavioral health side, we run 1 hour, 90-minute appointments.
I see.
And so it's a very slow operation. And when you bring those two together, it doesn't mix. Not to mention the coding and all of the different contractual types of obligations with behavioral health that typically on the physical health side doesn't exist. So there's this misunderstanding of what all it takes to run a behavioral health program. And then to your point, you can't bring one or two or three clinicians in to be all things to all people. So then what you tend to do is you tend to see the same 10% of your population, 5% of your population, and then refer the rest out, which then defeats the purpose of bringing behavioral health in. What I've seen work really well is private-public or private-to-private partnerships. That tends to work really well. My area of expertise is in behavioral health. Roya Health, we do it very well. Your expertise is in the expertise of pain. Why don't we come together and say we have a shared common goal to ensure that our members get that whole healthcare type of approach to the care?
Absolutely.
And refer to one another when appropriate. I've seen that work quite well, and it's meaningful for the patient because we're aligned on the treatment path, and it's certainly meaningful from a business aspect as well.
No, I think that's beautifully said. I think that when companies come together and collaborate, rather than this is my patient, that's your patient, but instead they say, how do we just help the patient?
Right.
And the focus is where it should be on the patient. That's where you can really get the true meaning of healthcare, which is focusing on restoring the patient's quality of life. So I absolutely love that. So shifting gears a little bit, you know, a lot of people don't even realize all the different areas of what's mental health. We look at physical health and, you know, if my foot hurts, I'm going to take care of that. But if I'm depressed or if I'm anxious or, you know, I have some of the other issues, I'm like, maybe I don't talk about that. Maybe I don't tell people. Maybe I don't treat that, right? And so for a long time, we've seen that mental health has kind of been this taboo area. You don't talk about it. You don't treat it. And I think a lot of people have suffered in silence for a very long time. I do also feel like we've had a little bit of a renaissance where people are starting to look at that as we get a better understanding of what it is. How do you feel like mental health has evolved as a from a general PR with the public, from the public's understanding of mental health? How has that evolved, and how do you feel like that's a good thing?
I would attribute our evolved model to the pandemic. I think it was during the pandemic when guards came down a bit, and I was joking with my colleagues that we somehow became cool during a really challenging time in all of our lives in healthcare, where people were feeling a lot of isolation. They were highly depressed. Divorce rates were unfortunately at the highest I've ever seen. Child suicides were at the highest I've ever seen in my career during that time.
Wow.
And so it was just, I think, sort of the outcome of the pandemic and being isolated within the homes for so long, that then folks started to say, okay, you know what, I have issues that I'd like to address, and I'd like to exercise my mind a little bit more and kind of lean into the mental health, behavioral health world. I think that's still the case. I think we've certainly progress. We're in a much better place today than we were 5 years ago, 10 years ago, as it relates to just openly talking about every single one of us who've had some sort of trauma-related experiences in our childhood. It's not immune to any one of us, regardless of demographics, regardless of gender, cultural backgrounds. We're all one in that. And so I think that we're in a healthy place because of folks coming forward during the pandemic and saying, yes, I need to talk to someone.
Like that silver lining.
The silver lining, indeed. Now, at Roya Health, we provide services to the underserved. And the pockets of the zip codes throughout Greater Phoenix are, I would say 85% are Spanish speaking only.
Oh, wow.
And all of our therapists, all of our case managers, all of our providers are Spanish speaking, which is wonderful for our population. And I would say that within the Hispanic population, it's also gotten to the point where families are openly talking about any of their children or themselves feeling as if they're depressed or anxious or maybe have some mood symptoms and irregular types of moods that could then spark some discussion about initiating behavioral health or mental health services.
Yeah, I mean, I lived in Bolivia for a few years, and I remember when I was down there, I don't think I saw anybody that was even considering mental health stuff. Now, it's third world country. Maybe it's just not as important as some of the other stuff they were dealing with, so I get that. But it was not really a thing, and they probably needed it because there was a lot of wars and, you know, there was a lot of trauma that was there. But the fact that you're seeing that a lot of people here in the U.S., regardless of a race background or anything are actually getting the help that they need with mental health is fantastic. I love that. So speaking to you for a moment, not as the CEO of Roya, but as an entrepreneur, I want to just talk about this for a moment. So being an entrepreneur is very mentally taxing, right? You deal with stress and anxiety that I feel like a lot of people will never experience in their lives unless they decide to start their own venture. How have you seen being an entrepreneur and being a psychologist? How have you seen, what are the maybe top tips that you have for dealing with stress as an entrepreneur in a healthy way?
I think surrounding myself with good people is very helpful. It can be quite lonely being a CEO or an entrepreneur.
Yeah.
And back to my original thoughts of I don't know everything about everything. So knowing that there's a support group out there that you can connect with, that you have your peer group that you can open up to, be vulnerable with, I think is really important. I also think that having a balanced approach to it all is also extremely important. I give just enough time to, almost scheduling in the stress and the anxiety related to strategically how's my business going to look in 6 months, a year, 3 years from now. And then I also want to make sure that I have that, if not 3 times that, time with my family and my friends. And I think a lot of entrepreneurs forget that piece of it until it's too late, and now they're really in that sort of chronic phase of stress and anxiety. I also try to practice something for myself as it relates to mindfulness. I think that's important, whether that's 5 minutes, whether that's, during my exercise time, and I'm intentional about it. I think that's really quite important. But, there's not a lot of us who kind of dive right in and do this kind of work. And so we got to give ourselves a little bit of grace too. I think if we're talking tips, being kind to yourself and saying, you know what, maybe this wasn't the best direction, for example, that I thought was going to be it. So then we pivot. Yeah. And that's okay. And I'd like to see more of our entrepreneur friends pat themselves on the back and give themselves some grace for being in that category of folks.
I think that by the nature of being an entrepreneur, you see problems in the world, and seeing problems in the world constantly can be very mentally taxing, right? And you also are going to see problems in your own work, and it makes you a really good entrepreneur because you're going to work like crazy to solve those problems, but it can make you a miserable human being, right? Because you're constantly seeing problems in the world. So I love the idea of having grace for yourself so that you can say, hey, like I'm solving these problems, and even though things aren't perfect, right, we're making progress, we're moving in the right direction. Have you ever heard of the 4-burner theory before?
No, tell me about it.
Okay, so this is the way I heard it was actually as it pertained to entrepreneurs. So essentially what it says is if you have a stove and you have 4 burners on it and you have a propane tank on the side, you only have a limited amount of fuel, but each of these burners can only burn so hot, or it can only take so much fuel. So what they are is it's family, it's work, it's friends, and it's health. Those are the 4 burners. In essence, it says that for one to burn hotter, it has to steal fuel from one of the other ones to burn hotter, right? And for me, I found that to be very true. I found that as an entrepreneur, I burn the work one very, very hot. It's something that it's hard for me to relax. When I go on vacation, I'm thinking about work. I'm constantly driving towards that goal. And when I was thinking about this, when I first heard about it, I went and reflected on, well, how's this affected me? And, family, I've really put a huge focus. Family's so important to me. I'm like, well, that burner can't go down, so I try to keep that. Then for a long time, I was stealing from 2 burners, friends and from health. And I made a huge effort on health, was like, I can't keep doing this if I don't focus on health. So health became one. But I will say that when it comes to friends, I don't have a lot of friends, right? And I think that when you talk to entrepreneurs, they're going to sacrifice in one of those areas just by the pure nature of work takes so much out of them. So as a psychologist, what are your thoughts on that theory, and have you seen it be true in your life?
I think it's a very relevant theory, particularly as it pertains to entrepreneurs. For me, as I was hearing your story about, okay, so which burner is the hottest? I'd say work for me, it burns very hot. Family burns very hot. As a mom of 2 young boys, I am giving them all I've got outside of work, where unfortunately we've got like low and we got to turn it up a bit is in the areas of friends and health. So I think that resonates with me very well. I also think being aware of it is one piece of it, but then actually intentionally taking actions to rectify that is another. I think I'm really good as a psychologist to talk about theories
Yeah.
and how to apply them, but internally, sometimes us as clinicians, we're the hardest ones to take our own advice.
Absolutely.
And so I'm intentional about making sure that whatever tips and recommendations I'm giving, I'm certainly applying them to myself as well.
No, I think, unfortunately, we're usually the worst patients, even though we
Are the worst
understand all the things. One thing that comes up a lot as we're talking about entrepreneurship is work-life balance. Do you believe in work-life balance? Is it a real thing or is it a myth?
Is it a real thing or is it a myth? I think it can be a myth, especially as we just talked about. We theorize, we talk about hypotheses a lot. I say the difference is knowing it in your mind versus in your heart. And so I do think it absolutely can be applied and you can have that type of balanced approach. But I also think there's always one burner, back to your burner comparison, that you're going to need to kind of touch on.
Yep.
Because life isn't perfect. So there's going to be times where you're just going to kind of fall off and forget that there are other areas of your life that you need to pay attention to, but then pay attention to it when you realize that that's coming up for you, right? Again, it goes back to grace. I think we as entrepreneurs are so type A, we're so obsessive over success, even the 4 burners, success in those areas, that we sometimes forget that our 50% is someone else's sometimes, 100%.
Yeah.
And so we got to remember that and give ourselves
Well, and to your point, giving others grace, I think that as an entrepreneur, it's really easy to think that everybody should work as hard as you do, right? You're working 18, 20 hours a day. It's like everybody should be working this because look how important it is what we're working on. But when you try to hold people to the standard of a founder, entrepreneur, you're going to always be disappointed in great work. And I think that being disappointed in great work will always lead to the demise of any company because you're going to hold people to unrealistic standards. Now, I think it's great to hold people to high standards, but I think that trying to hold them to the same standards as you hold yourself will never happen because they don't have the same upside as you do as an entrepreneur, both from financial, but also in the fact that this is your idea, this is your baby, this is your brainchild. Nobody's ever going to be as passionate about your business as you will. So I think it's an unfair standard. So I love that you keep touching on grace because I think that it leads to a lot of happiness. When you can find grace for yourself and you can find grace for the people that you work with as it pertains to those areas, you're going to turn the same circumstances that would have caused you grief before into allowing you to experience joy. And I think that's really important. I think that's one of the biggest things I've learned about grace is how it can bring joy into life, right? Any thoughts on that?
Just being grateful every day. As a friend of ours says, you get to do what we do, right?
Yeah.
So really shifting your mindset and allowing yourself to make mistakes and allowing yourself not to meet your own internal key performance indicators from day in and day out. I've learned a lot of that this year. I think it's important to hold yourself to a high standard, but also allow yourself to fall sometimes.
Sometimes we fall, but it's not that we'll fall, it's what do we do once we fall, right? We get back up and we keep going. For me, work-life balance is something that I like to look at it as work-life integration. For every person, it's going to be different. The amount of work that I do and that I enjoy doing is different than what other people will do. Some people would hate to work as much as I do. I like it, right? And so when people are like, oh, you need a better work-life balance, I think that's such an individual thing of you can't say what the right balance is. That's why I think that work-life balance is a myth. There's no balance. For one thing to go up, something else must go down for there to be balance. And for me, it's more about finding the healthy integration of work and life to be able to say, I'm giving the proper amount of time to those 4 burners that's right for my scenario where I'm at right now. There will be times in life where by necessity something has to burn hotter, right? And maybe that's work and you have to push really hard at this point in your life. Maybe it's family because your parent's sick and they need all of your attention and time, and other things are going to suffer because it needs all of your attention at that time. It's not that it's out of balance. It's that there's different times in our lives that we require a different balance through those. And so my personal philosophy is ponder on what's right for you in a healthy manner. Find out which burners need to be hotter. Maybe some are not as hot as they need to be. But sit down, do it consciously. Think about what's the right thing for your situation, and then put intention and focus onto the things that are most important. And when you do that, I feel like you're going to have a lot more happiness rather than burnout, because you're seeing results in the right places. So, personal thought on that.
Yeah. You know, you just touched on burnout. I was going to talk about burnout only because it pertains so much to what we do, particularly in the healthcare space. We spent a lot of time at my company focused on how to prevent it. And that means just leaning in and asking, how can we make the work lighter?
I was just going to ask you, so how do you prevent burnout, Shar?
Yeah. Well, you know, I think technology helps a ton in the clinical space as it relates to that administrative overhead and burden that a lot of our clinicians feel. For me, it's making the work lighter for our staff, making sure that the time they're dedicating to the work is really focused on what they love doing. So if I'm spending 80% of my time during an 8-10 hour workday hating what I do, then that's not the job for me, and I'm going to burn out. And so we spent a lot of time asking. And so I would say asking your staff is really important. Asking my family about what's working for you, what isn't related to our relationship, and is really important. And I have been shocked with some of the answers I get from my staff as far as what makes them happy. And a lot of it has to do with interpersonal relationships they have at work with their colleagues that keeps them joyful, that keeps them connected to the company, that keeps them engaged in what they're doing, but then also having fun. I think sometimes we forget about the fun factor. So it's really, really imperative.
It's really hard to get burned out while you're having fun.
Right. That's right.
Like, I think I haven't really put it in that perspective. I love it. For me, burnout has always been two things. It's been fulfillment and progress. I feel like if you're doing a job that gives you no fulfillment, you're going to be burned out and you're going to hate it. If you're doing a job where you see no progress, you're going to get burned out, you're going to hate it. But oftentimes we see people that relate burnout to how hard you're working. And I actually fully disagree that burnout has nothing to do with how hard you're working and everything to do with are you getting fulfillment and are you seeing progress. There are people that say, I used to love what I do and now I don't. Well, it means you were getting fulfillment and now you're not. You were seeing progress and now you're not.
Or you were having fun and now you're not.
And now you're not, right? And I've never added the fun. So that's a new one for me. Now I'm going to add fun in there of like fulfillment, fun, and progress are now the things. Like if you are fighting burnout, look for those three things and you're probably going to be in a lot better space. Are you having fun in the job you're doing? Are you getting fulfillment? And are you actually seeing progress towards meaningful, worthwhile things? So I love that. That's a good one. I'm glad you added fun to the burnout theory.
You're welcome. It's yours.
That's mine. I'll take it. So I want to talk about happiness since we're in that space of burnout for a moment. There is, as you know, I study philosophy a lot. I love to do that. And I was studying some philosophy recently, and it says that there's two ways that people look for happiness in their life. It says that they either look to have more happiness or they look to get rid of unhappiness. And I feel like in today's culture, most people try to be happier by looking to get rid of unhappiness rather than looking to add happiness to their life. So, give you an example. I feel like a lot of people, it's like, well, if you're not happy there, you should stop doing it. If you're not happy with that, you should stop doing it. But the truth is, in life, we have to do a lot of crap that we don't like. And trying to eliminate everything that you don't like, you're never going to achieve that, and you're always going to be disappointed. But when you're in those hard moments and you're dealing with crap that you can't get out of, you're dealing with stress that you can't escape, it's not about running away from the stress. It's about adding more happiness, right? Looking for those moments to say, even though life sucks right now, I can go have that moment with my friends. I can have those moments with my family. I can be grateful for some of the good things in my life, even though there's some things that I don't want in my life right now. And I feel like the two paths, one leads to much more happiness, and one leads to frustration and grief because you're constantly trying to eliminate something that you have no power over to control. And so between those two things, I have personally found philosophically that the way to add more happiness is not to get rid of things that don't make us happy, but instead to find and search for things that make us more happy and bring more joy to our life. What are your thoughts on
Good
that?
mindset. You know, anytime I've run into a challenging situation, philosophically, I ask myself 3 things that are going well in that situation related to the concern or the challenge. Because, for example, a flat tire.
Yeah.
Like, okay, I have a flat tire. It's in the middle of the night. What are 3 things I'm grateful for that are going well in my life? Why would I do that? Well, I have a nice car still, right? To be able to have this flat tire, I still can call AAA. I've got family who comes I'm very close to. And that shifts your mindset from, oh crap, I got a flat tire, to I'm still really grateful for being in this position right now. It's a blessing. And so that for me is joy. When you can find those moments of, I'm going through a hard time, but I can still infuse what I'm grateful for. Is just you're shifting your mindset. The other piece is, to your point, we have to do hard things. That's just
Life.
how it is, and that's life. And if you don't do hard things, you're not going to train your brain to be resilient, to have grit, to be able to push through it and know and learn from that experience. If you run away from it, you're actually training your brain to be anxious. And so it's really important to lean into those situations and be grateful and use good coping skills and add to the joy, as you're mentioning, so that you are in a stronger position because of it. And that's what I try to teach my kids and all of our patients at Roya Health. I'm sure you're the same.
Well, I love it because you look at children, and there's a term called helicopter parenting, right? Which is, they can go through nothing hard. I will be there. I'm going to knock down every wall. I'm going to make sure that they don't have any challenges. And I feel like when you do that, you make weak adults, right? Because if nobody ever goes through hard things, how do they know what they're capable of?
That's right.
If they never see their own strength, how can they know they have the strength to overcome the next challenge? And so I take that application very much towards my kids. And the CEO of NVIDIA says it really funnily. I think it's Jensen. I'm going to slaughter. I won't get it right. But he says, I hope that you have suffering at some point in your life. He goes, and I mean that with great joy. Right? And he says it because he goes, when you struggle is when you're going to grow and what you're going to learn what you're capable of. And in that is where you're going to find happiness.
That's right.
Because the depth of your sorrow will only be matched by the height of your joy. If you ever experience sorrow, how can you know what happiness is? And so I love that we're going to go through hard things when we're working with people, when we're working with our kids. Like, it's okay to have, let your kids earn some grit and to do hard things, because it's going to make them better, stronger adults. That's so good.
That's right.
Okay, so you mentioned gratitude multiple times here. In psychology, at least from what I've read, gratitude is one of the best things for fighting depression and anxiety and stuff like that. Can you talk about what is it about gratitude that's so helpful to mental health?
Well, in the realm of just being kind to yourself and others, and looking at the glass as half full, that's a simple concept but very profound concept in your mind. The easiest form I can tell you from an intervention perspective is keeping a gratitude journal. Writing down 3 things you're grateful for in the mornings, same thing at night, and just checking your mood after 2 weeks to see if that type of documentation of gratitude is going to be powerful for you. The other piece is, it's really important to know that words matter.
Yeah.
And
words we tell ourselves and others, right?
That we tell, particularly ourselves, though, which, a lot of research shows there's a lot of negative self-talk, particularly for those who are experiencing any kind of chronic depression, anxiety, mood disorders. So it's important to start to track what you're telling yourself and how you're telling yourself and what moments you're telling yourself that type of negative self-talk, and then replacing it with talks of gratitude. And again, don't take my word for it. Try it for 2 weeks and see how your mood just organically is uplifted through that.
So it's journaling down the things you're grateful for, 2 weeks, writing them down, and just seeing how your mood changes. Is that the challenge?
Yeah. That's the challenge.
Okay. I love that. I feel like gratitude is interlinked very much with joy. I can be having a terrible day, and if I sit and go, I'm grateful for this and I'm grateful for this, if you just keep going as long as you can what you're grateful for, your mood, at least for me, it's impossible to stay in a bad mood when you start realizing all the great things you have going on for you, right? The fact that we live in a first world country, there's things called first world problems. I feel like a lot of the issues we have are very much first world problems. It's like, oh, I don't like this food. It's like, but you have food. It's like, oh, my car broke down, but you have a car, right? And so I do think when we take the moments, even in the flat tires and the bad situations, to be grateful, we recognize the incredible blessings that we have. And it's really hard to not be happier when you recognize what you have rather than what you don't have.
That's right. Well said.
I do feel that gratitude and optimism are very closely connected. How important do you think it is as an entrepreneur to have an optimistic attitude?
I think you'll fail if you don't have an optimistic attitude. Because as entrepreneurs, we have to try all kinds of different initiatives and projects and throw almost everything we know out there and hope it sticks.
Right.
And you and I both know a lot of it doesn't stick, but the 2 or 3 things that do stick, it's quite successful for you. So if you give up because you're not very optimistic after the first few times of failing fast, as we'd like to call it, then unfortunately being an entrepreneur is probably not the best for you in your career. For me, I think having that type of optimistic point of view, really leaning into that and giving myself grace in that sometimes we're going to have a bad day, but bouncing back from that is key to my success.
I love that. There's a phrase that says, only the optimists will ever change the world because they're the only ones crazy enough to think it might work.
Yeah.
Right? And so I love that idea, though, of you have to be willing to believe something will work with such passion that it pushes you through all of those failures. And people will think you're delusional, and people will think that you're crazy and say, why do you keep doing that? It hasn't worked. You keep doing the same thing over and over again. But it's those type of people that go, it's going to work, and I'm going to show you, and they keep going. And those are the people that truly change the world. And I feel like as entrepreneurs, we have that little gift of being able to say, to believe when nobody else does, to see something that nobody else does. And there's another phrase that I really like. I was talking with a friend, and he's very analytical, all the details, everything, all the reasons. And this phrase came to mind, which I don't remember where I heard, unfortunately, but it's, okay, well, you can be right or you can be rich, right? And I just love that phrase because essentially 99% of the times that person who looks at all the details is going to be right. It's not going to work out. But the one time where it's going to become a rocket ship and go to the moon, they won't try because the 99 times on paper it wouldn't work out.
It wouldn't work.
But the optimist,
that's right,
the entrepreneur that takes that swing, even though they failed all 99 times, they're also going to try that 100th time,
that's right,
and they're going to knock it out of the park. And they're the ones that make it to make these billion-dollar companies, these huge life-changing things.
That's right.
Because despite it not working on paper 99 times, the one time it does work, they're still trying.
Yep.
And I think that is a perfect encapsulation of like being an entrepreneur. You have to be willing to fall the 99 times to be able to have the success the one time.
Yep.
As a psychologist, are we crazy? Or is entrepreneurship something, like, is it an actual mental disorder that we are willing to fall that many times, or what?
It might be in our diagnostic manual. I don't know. Next time, I don't know if you've seen our diagnostic manual. It's this thick. Mm-hmm. Every disorder that you could ever think of is in that lovely book. It keeps growing. But no, I think that, to your point, we must have a little bit of insanity in us to be able to continue to do the work that we're doing and be entrepreneurs and push the envelope. Fail so many times, but continue going at it, having that grit. Mm-hmm. But who's going to do it if we don't, right? I was going to put a spin on your "do you want to be right or do you want to be rich" comment. The psychological spin to that is, do you want to be right or do you want to be loved? And I think that's the way I lead my life, whether it's as a mom, as an entrepreneur, as a leader. And I always choose love over being right.
So how have you applied that? Like there's so many things going through my head as I hear that, but how do you healthily apply that? Because I feel like you can get to a point where it can be unhealthy, right? You can be right or you can be loved, and it's like, well, I just want to be loved, so it's fine. I'm going to let them get away with it.
Yeah.
Like, you know, the extreme, I mean, you can see that in an abuse situation of,
Sure.
you know, there's all these issues going on, but I want to be loved, so I'm going to choose love. Like, how do you make sure, because I agree with you 100%, and there's a really good, healthy way, and I'm sad that my mind goes to this bad way, but how can we make sure that you can be right or you can be loved is done in a healthy way with healthy relationships?
Balancing it is important.
Yeah.
For me, I can speak for myself. I grew up most of my life wanting to be right. And then I realized, okay, being right can be a very lonely place.
Yes,
so then I quickly switched to, let's choose love first, meaning let's put the relationship first. It's not always whatever you want, it's putting the relationship first.
Got it.
And whether that is somebody I'm you know, supervising, to my husband, to my kids, to our patients, it's making sure that the relationship is healthy so that we can work towards a resolution together when there's
great.
conflict.
Yeah, I mean, there's a lot of stuff that we push to be right on that doesn't matter.
Right.
And I think that's kind of to your point, right?
Right.
With your kids and with your spouse, it's like, does this actually matter? No. Like, then why am I fighting so hard to be right rather than the health of the relationship, right? And I think that's a really good application of it. And to your point in work, there are times when you need to stand up for what's right. Of
course.
And it's super important. But when it doesn't matter, look at the relationship and the health of the relationship and putting those higher priorities. What's more important right now? If it is to be right, then fight for it and fight to the death for it, right? But if it's not, choose a healthy relationship and love over just being right for the sake of being right. Beautifully said, Shar. That's so good. So, entrepreneurship's not in your manual under disorder, mental disorder? Not yet.
Not
Okay.
yet.
Well, I can definitely see it being added one day because there's times that I feel crazy. But at the same time, I also think that entrepreneurship brings such a joy because it allows you to express creativity in a way that I feel like there's not a lot of other outlets. You're truly taking something from your imagination and bring it into the physical. And I believe the Bible talks on this, and I love it. It says, first there's the spiritual creation, then the physical creation. And I believe that's what entrepreneurship is. You first create it here, and then you create it out in the physical world. And being able to be a creator rather than a consumer, being somebody who can create something that other people value, to me brings such joy and fulfillment that I don't know of any other activity besides being a parent where you're creating life in a child, that you get to experience that type of creation, right? So I don't know if there's any science on the joy of creation, but I feel like entrepreneurship definitely brings that for me. What do you get out of your entrepreneurship? Do you get that type of fulfillment, or what cup does entrepreneurship fill for you?
Given that I'm in the behavioral health industry, I always say we get an emotional paycheck every day. So for me, whether I'm a hired gun or an entrepreneur, doesn't matter. It's that idea of I've made an impact in someone's life that has been not only life-changing for them, but also it's going to change the trajectory of their health and longevity. That's enough for me to be able to sleep well at night. Now, the entrepreneur in me says I want to do that for a massive amount of people. And to your point, that value creation of I've created something magical for people, and that's not ever going to go away. That's enough for me to continue with this insanity.
I love it. So again, I'm going to switch gears one more time on you. So Roya Health, you talked about how it partners with primary care and different types of specialties to bring in really well-structured behavioral health into their organization so that you can provide a very needed service at a site where it's convenient for the patient.
That's right.
How did you come up with this idea, and how's it taken off?
Yep. Thanks for asking. So our partnerships with Happy Kids Pediatrics and Felice Care. They're the largest pediatric and primary care group in town. They have 11 locations, 75,000 members.
Wow.
And when we partnered with them, they had only behavioral health screening tools and that they would refer out for behavioral health services. But what they were finding is more than half of those members weren't even making it to the referral source.
Wow.
Access to care issues, too many miles away. And so I said, well, what if we just came right there and we're able to have a co-located model? And the state of Arizona is quite progressive. We're actually one of maybe 7 states in the entire nation that has this kind of model that they support.
Wow.
And so I commend our state for really pushing the physical and behavioral health integration. And so we honestly just tested with one site just to see how quickly the show and the attendance would rise. And within months, we realized thousands of members are more than likely to go get a wellness check for their children and walk right in the breezeway, come over to our office and schedule an intake appointment.
That's incredible.
Versus before, when they would refer out to maybe 2-3 miles down line. So now we're in 3, we're going to be in 4 locations, and now we're looking strategically to be in every single one of their locations so that we can go ahead and provide that behavioral health care to their members that they serve.
I just think that's so smart. I've seen this done in assisted living, where they've brought in care for that exact reason. It's needed, but it's inconvenient.
That's
and because
right.
it's inconvenient, compliance goes down.
That's right.
Right? So I've seen this in different areas, but I've never seen it in primary care. Actually, immediately I'm like, well, why don't you do this in pain? Right?
Yeah.
Because I just think of all of our patients that massively need more than we can give them in the behavioral health space.
That's right.
Have you considered branching out and doing this same type of model in pain?
I absolutely have, and I'd be interested in talking
We'll
about
talk
it.
about that.
And pain practices are very similar to primary care and pediatric offices in the sense of the way they run their operations. It's just a matter of front and back office understanding when to refer to behavioral health and allowing us the opportunity to really blend in and be part of that multidisciplinary team that works really well for the patient and for the practices.
So where did you see this problem, and what made you go, I'm going to create something that solves that? How did you first kind of see the problem that you identified?
It was the CEO who came to me, the practices, who said, we have little to no behavioral health resources. We just screen and refer, but unfortunately our members are still ending up in the hospital. One of the aspects of behavioral health that's so powerful for a pain practice or for primary care or pediatric offices is we actually cut costs by coming in, because then our members feel that they can call us if they need something versus going to the hospital for their care, which the hospital is quite costly, as you know. We come in, we provide in-home services, we provide in the office telehealth, and so that really helps to bend the cost curve for the health plans and also for the practices, which is really important. And also we do a lot of case management. We are ensuring that we're, talking to them about employment, about housing, about how to even attain a food box for those who need it, in addition to layering on some of the counseling services that we offer and then the psychiatric services that we offer.
That is so cool. So when did you first know that you were onto a success, that it was going to take off?
I didn't. I took a leap of faith. I would say I barely touched this model up until this last January, meaning I just organically saw how it would transpire, and it took off. And our clinician said, oh, we need to hire another clinician and then another one, just because the referrals kept coming through. And members were really enjoying the services, and the stigma wasn't there because we were right there on the premises. So I would say I didn't know. And I just took a leap of faith. I was very optimistic, but I knew enough to be knowing that that's an area that we want to explore. And quickly we realized that this was an unmet need. And if we continued on this path, we would be successful.
I love that. I feel like that so many times as an entrepreneur, there is a moment where there's a leap of faith, right? It's whether you go all in on something, you bet your savings account, you leave your job. Like, regardless of what it is as an entrepreneur, there's going to be a moment where you step into the unknown.
That's right.
And it either works or you fail.
That's right.
And the people that are willing to take the risk more often than not, I think it does work out for them because they're willing to bet everything. And I think there's an aspect of success that unless you're willing to bet everything, you're just not willing to do the work necessary to get over the hump of how much, in neurology we'd call this a threshold, which is before a nerve fires. There's a certain amount of work that has to happen before it just explodes.
That's right.
And unless you're willing to bet everything, oftentimes you don't hit that work threshold to see the giant success after. So I love that you're pursuing this. I love the difference that you're making. There's one last thing I want to close on as we're going through. I know that it's really important, not just dealing with mental health, but also You mentioned how you like to help young women, whether it's through mentorship or other things. As a very successful female CEO, this is something that you're passionate about. I'm curious, where did that come about, and how are you currently working on fulfilling that need?
Anyone who wants mentorship, I am available for them in terms of my company and any other, particularly young females. And the reason why I've focused on young females is because oftentimes, particularly in the underserved areas, they don't get opportunities. I still see it where 14, 15, 16-year-old women, girls, come with little to no confidence, for example. And it might be a simple concept just to infuse self-confidence in them. But again, it's pretty profound when you realize how insecure some of these young girls are. For me, it is a call to action. I think spiritually, it's something that's in me. And I will always be that mentor for young women or anyone who's interested in learning more about my journey and how I can help them progress and be successful in their lives. But also, I had great mentors. And so when you come into this realm of whatever you're doing in life and you've got great mentorship, you're doing a disservice if you're not paying it forward. And so for me, it's really important to continue to pay it forward, and it enhances my joy.
I love that. So I say this in part because, I have a young daughter. I have two young daughters, one's 11 and one's 6. But the 11-year-old, definitely I can see some of those confidence issues and stuff like that. I mean, as a teenager, I'm sure there's massive confidence issues, but we're starting to see that, and I want to encourage her. So as somebody who's very confident and successful as a professional, how did you attain your confidence that you have? You mentioned that a lot of young women don't have that. How did you get to the point where you can stand up, whether it's, defying the odds or standing up in a boardroom full of men and say, this is what we're going to do? Like, you have that confidence to stand up for what you believe in and to push forward. How did you get that?
I used to be scared of my own shadow until I was about 22 years old. And it was a really challenging upbringing for me because I came from a different country. Everyone thought I was Hispanic in Arizona, which I was not. I'm Iranian. And so that kind of made me feel like I was out of place. It made me very shy and insecure. So I haven't always been confident. It took stepping outside my comfort zone. It took mentors who said, you've got something and you need to step out into the light and stop being in the shadows. Where I started to quickly learn that I have to just continue to be uncomfortable for me to really push forward and be confident. And confidence is I would say, ever-evolving concept. You don't just wake up one day and you're confident. There are days where I'm not confident, and I'm confident enough to say that.
Yeah.
Right? And so being good in your own skin, being authentic and genuine, that takes time. It takes maturity, and it takes a lot of support and practice to be able to get to a place where you can walk into a boardroom full of men and say, this is how it's done.
So for the young women that are out there that hear your message and say, wow, I want to be more confident like she is one day, do you have any just simple advice they can start on now?
Yeah, I would say step outside your comfort zone. That's first and foremost. Get yourself a mentor. I think we can put my name down as someone who would be able to help. And then try as much as possible to do something that is not only outside your comfort zone, but that's going to propel you into the future. Whatever that is. Currently you're at fear, kind of holding back, and you want to certainly propel that into the future. Those are some mini recommendations for folks.
I love that. This isn't necessarily for young women, but in general, the one thing that has helped me to be more confident is to say, once you realize that there was nothing to be afraid of, your fear falls away.
Yeah.
Right? And I feel like your advice to try new things and to get out of your comfort zone, stop worrying about what other people think and worry about what you think. Worry about what you think about yourself. And if you're happy and you're comfortable with what you're doing, you find something that you love and that you enjoy, who cares what other people think?
Who cares?
Right?
Yeah.
And so I love that. Try new things, but also just stop worrying about what others think and worry more about your own view of yourself.
Yeah.
And I think that when you do that, you can gain massive confidence with that. But I love that. Thank you so much for sharing that.
I have a quote. Is
yeah,
it all
please
right
do.
to share?
Please share.
So, working with a lot of young women, I was just reflecting on your question. a lot of the individuals that I've mentored have had some pretty significant traumatic backgrounds.
Yeah.
That has impeded their ability to be confident and to propel forward, try new things, do the things that we just talked about. And I just read a quote the other day, which I think is brilliant in this situation, which is, not everything that's happened to you is because of you, good or bad.
Love that.
And knowing that going in, I think, is pretty powerful for folks who are trying to combat the fear and gain more confidence.
So powerful. I love that. Okay, my last two questions in closing, okay? We ask just about everybody this.
Okay.
It's part of our segment of Doctors Unscripted, okay? So obviously we work really hard to try to fight the opioid epidemic. We have over 100,000 people dying every year from opioid-related issues. One of the main reasons for this podcast is trying to create education and advice and thoughts and just different conversations that can lead to progress in this space. So here's the question. In your opinion, and from the work that you've done, what are some ways that we can help to defeat the opioid epidemic?
It's very simple for me. Pick up the phone and coordinate care with the doctors, wherein you have a shared patient. Every single time that we've been able to coordinate care with a pain specialist or a rural prescriber who doesn't realize that we're the treatment provider who's prescribing too many medications, it's 100% of the time been successful. We don't do enough coordination of care in our system to save lives. We got to do more of that.
Man, you stole the words out of my mouth. I believe that solving the fragmentation in healthcare, when doctors talk, patients win.
Yeah.
Like, I truly believe that. That's why we do these conversations. And I love the work that you're doing with Roya as you're going to where the patient is and meeting them there and helping them get the care that they need. And I feel like that type of solution really solves fragmentation in a very incredible, sustainable way. So love the work you're doing there. If you guys need any type of mental health collaborator, please look at Roya Health. They're amazing. So last question that just tells us again to encapsulate this conversation, tell us who Shar is. If you could not have been a doctor, a PhD in psychology, could not do this career, what would you have done instead?
I've been asked this question one other time in my career. And this was 8 years ago or so now. I said a chef.
Really?
That's changed.
Okay.
Today, I would say being a mom.
Love that. I know you outside of this podcast, and you are an incredible mom, and I always admire how much passion you have for being there for your kids, despite being a super successful career woman. The fact that you put so much priority on being there for your kids is absolutely incredible. So love that. I can absolutely see that being true for you.
Yeah. Thank you.
As far as a chef, I'm just really upset that I've never tried your cooking. No, but I love to cook as well. I actually feel like cooking is one of the things that brings me a lot of joy, because it's similar to being a healthcare provider, which is you're doing a service that brings joy to people.
That's right.
And so I can see how the chef correlates to being a provider of healthcare, because it's so close.
It's the way
to,
I show love, too.
Service to bring joy, right?
Yeah.
So absolutely love it. And I think it encapsulates who you are, which is out there serving and trying to make a difference to bring joy to the world. So
thank you.
Thank you so much for being on the podcast. It's been an absolute pleasure to have you here.
Pleasure's all mine.
Again, Roya Health, they're doing incredible things. And with that, we'll go ahead and end the podcast. Thanks, everyone.